everything might not be fun.
Yeah, the politicians keep saying, why is our healthcare system so expensive? And like, duh.
How does that make any sense? We'll figure it out. This is the thing, I'm just getting totally unhinged now, and I don't know what to do. Hi, I'm running on the Baltimore-Annapolis Trail, which is a trail system in Maryland that connects Baltimore, pretty much, all the way to Annapolis. And we filmed in Baltimore last week, and we filmed in Annapolis a lot. I've actually taken the trail from my house in Columbia all the way to Annapolis, parts of it, and it's really nice. No cars for that long a trip, and there's stuff you could stop off on the way. It's really nice. And we're in Severna Park now, which is kind of in the middle. So I wanted to talk about another test and treatment that is often deceptively advertised to patients, and that is bone density test and treatment for osteoporosis. Osteoporosis is thinning of the bones, and when people have thin bones, they could fall down and break a hip or a back, and so there are drugs invented that can make the bones a little stronger. Things like Fosamax or Reclast, or more recently Prolia, which are pushed by doctors to say, we got to test you to see if your bones are thin, and if they are, we got to treat you with these medicines, and then you won't break your bones anymore. I remember when I used to round in the hospital, and I used to see people with hip fractures, and I commented to my colleague, everyone we're seeing with these hip fractures is on one of these drugs. What's that all about? If these are such wonderful drugs, how come they're all breaking their hips on them? So there are two kinds of fractures that can be prevented. There's a fracture in the back called a compression fracture, and then there's a fracture in the hip. Those are the two things that are measured. You measure your spine and you measure your hip, and if the numbers are low, you treat with these medicines. That's how it goes. So here's some reality. The back one is very revealing. So we know that we can have a major reduction in fractures of the back when you go on these medicines. Major, significant. But here's the kicker. In the studies that are done, what they do is they put people on a medicine or placebo, get x-rays down the line, a year, 2 years, 3 years, and see how many people have had little tiny fractures or big fractures in their back, and they lump them all together. Now people get fractures in their back for no reason, just walking, and they have no idea they have them. Most of my older patients have had a few and they have no idea. So they say, wow, look, this drug really cut down fracture risk, except none of these patients actually knew they had a fracture or care. They're minor fractures. They're just from bones squishing a little bit. That's what it is. And with age, that happens. And so they say that this is a major benefit of this drug. But really, the patients don't get any benefit because they don't feel better. The question they should be asking is how many people get relief of painful fractures in the back? And that number is far, far smaller. It's infinitesimal. Now, if you look at the other factor, which is even more important, which is hip fractures. So again, exaggerations are often given, like 20 to 30% reduction in fracture rate in people who go on this medicine versus people who don't, which gets the doctors to say you gotta be nuts not to be on this medicine. But here's the reality. I'll show you a theater. This is how many people actually prevent a hip fracture when they go on this medicine versus those who don't. As you can see, there aren't many seats in that theater. And all that fracture prevention occurs in the first 3 years. After 3 years, there's no benefit compared to placebo. Now take a look at this theater. There are a lot of seats in there. This is how many extra fractures people get by being on this medicine after 5 years. Yeah, this medicine actually causes fractures if you stay on too long. You can only stay on a couple years, or else boom, you get a fracture. And these are bad fractures. These are fractures where you take a step and your bone just cracks spontaneously. You don't fall or anything. So there's a problem. So you can't really stay on this medicine too long, or your fracture rate goes up and you get no benefit. People don't tell their patients that very much. And so what's the point of being on this medicine to prevent fractures for a couple years? And such a small number. How do you really prevent fractures? Well, instead of putting people on these medicines and checking bone density tests over and over and over again, why don't you just teach people how not to fall? Have them do exercise programs? That'd be a nice thing. Fall prevention is the main way to prevent fracture. And it's been shown that just by preventing falls, going in programs to prevent falls, that's the main way that you can avoid people from breaking their hip, whether they're on this medicine or not. This medicine is a tiny, 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 short-lived benefit, but it's pushed and pushed and pushed. I've had doctors, again, tell my patients they're total idiots for not going on this medicine, but this medicine has side effects. It can cause a lot of problems. It can cause people to have severe acid reflux. If they have it already, it's even worse. It can make them have nausea and vomiting. It can make bone pain worse. I've had several of my patients who have bad pain get worse on this medicine. So you don't take this medicine lightly. It's not a miracle pill. But again, it's using this fake calculation by saying, well, we're gonna look at fractures on an x-ray and not care whether people have symptoms or not. We're gonna exaggerate the benefit by using this number, and we're gonna push a lot of people to take it. One of my older patients who heard me talk about this drug said, is bone density the only way you can determine the risk of fracture? I said, what do you mean? He said, well, it seems to me that bone density is only one factor. How flexible a bone is might be a factor. How much fat pad there is over the bone might be a factor. How people fall, their muscles might be a factor. And he's right. Bone density is one factor. Turns out a lot more people break their bones with normal bone density than with abnormal. If they fall the wrong way, they'll break their bones. And flexibility is a big deal. The reason people get more fractures after 5 years is not because their bone density is low. In fact, their bone density is really high. It's just they're putting down bad bone. So you can have a highly dense bone that's bad. So you measure it with this bone density machine, you think you're doing great. You know, you don't have to worry about falling. You take a chance and boom, you fall. One of the problems with this drug is gives people too much confidence. And sometimes they might do something they shouldn't do. The reality is falling is the issue, not bone density. And by pushing a drug like this, we're giving people bad information. So you'll see this example over and over again. The idea that a drug can replace behavior changes, or exercise, or diet, or being careful. Using a walker if you need to use a walker, using a cane, holding on. You know, common sense stuff. You know, doctors don't talk about that stuff nearly as much as they talk about getting a bone density test and pushing a drug. And if you go to a specialist, like an endocrinologist, I've seen them just think this drug is like the Bible itself. You know, it's like what cardiologists view statins and blood thinners as. They just love these drugs. They think everybody should be on them. They keep testing and testing. I know people are experts in osteoporosis, but this is all they do. They test people and they put them on these drugs. And again, they do talk about the other stuff, but that's all they should talk about. This drug is nothing. So again, an example of a test and then a treatment that has a minimal benefit, and if you do it wrong, has a risk and has side effects that really doesn't get to the heart of the matter. And this is, again, a lot of what's going on in our medical system. So back to my run, and that I'm hoping not to trip and break something, but okay, see you later. Hey, hope you like the podcast. We'll be back next week. I'm going to give you some information. If you want to check the website, if you want to email me, if you got your own stories, let's talk about it. See you next week.